Welcome to the course on Copy and Paste Functionality Guidelines. This course will discuss the appropriate use of copy and paste functions within our electronic health record system. After completing this course, you will be able to define copy and paste functionality as it pertains to patient health information, understand and abide by Ascension's Texas policy regarding copy and paste functionality, avoid and understand the risks associated with copy and paste functionality, recognize the author's responsibility for documentation within our EHR, identify the major guidelines for copy and paste functionality in regards to appropriate and inappropriate use of this function, and identify what information can be copied and pasted and what needs to be written out with each patient visit. This course is designed to inform providers and associates on how to appropriately use copy and paste functionality within an electronic health record. Copying and pasting information involves a series of actions performed on a desktop, laptop, cell phone, tablet, or any other device that allows this functionality. Here are the keyboard commands. Control+C to copy information. Control+V to paste. Copy and paste functionality also includes the following: advanced copy, forward, and auto-populate. This is the placement of clinical information by either the staff or EHR software into the current clinical record before the practitioner takes control of the documentation process within the current clinical visit. Exploding macros, a function whereby the simple act of clicking on a single word or symbol results in the automatic documentation of a preset series of data elements. Imported documentation is documentation that has been inserted into a medical record as a result of utilization of the copy and paste function or some other system interface, or any process by which a document or information contained in one digital document is imported unchanged into another document. Ascension Texas Copy and Paste Functionality Policy. All individuals documenting in an EHR are responsible for the accuracy and integrity of their documentation, whether the content is original or imported from another source. Review for cloning is performed during the clinical and auditing process. Potential cloning will be reported by sending a completed copy and paste form to copypasteissues@ascension.org. Corrective Action Policy monitors reported copy and paste functionality and determines any corrective action that may include additional education and referral to CNO, VPMA, or CMO for disciplinary action. The use of copy and paste functionality to import documentation from one patient record to another is prohibited. All individuals documenting in an EHR shall receive education on appropriate use of copy-paste functionality and sign an attestation that they will comply with the CPF policy. Imported documentation should be edited to assure that only accurate and medically necessary imported information remains in the current encounter note. Any errors in imported documentation should be corrected by the provider for the patient's current visit. Any recognized errors in the source documentation should be reported to R1 RCM HIM Operations Manager. When the current provider uses copy and paste functionality to include important patient documentation regarding care, it is essential that the information used lists the author's name. Avoid copy and pasting information from a previous visit verbatim without sourcing the author. Review Addendum B Copy and Paste Functionality Guidelines. These guidelines provide a refresher and help to ensure proper use of this functionality. Appropriate use of copy and paste functionality. Use copy and paste and copy forward functions with extreme care. Medical records should be brief, selective, and pertinent to the care provided during the current visit. Be integral, relevant, and medically necessary to the current encounter. Be clearly attributable to the individual who performed the work. Provide progress notes that have an accurate description of treatment provided on a specific date of service. Affirmatively list that there has been no change in information when copying and pasting information that is verbatim to the current record. And source the name of the previous author when copying and pasting medical information from the past to the current record. Copy and paste functionality, patient safety, and billing risks. Patient safety risks can include, but is not limited to, the introduction of outdated and inaccurate information within the EHR, inconsistencies within the EHR, and repetitious and irrelevant information that leads to lengthy EHR records, which can overwhelm the reader. Billing risks can include, but are not limited to, CMS and insurance denying a claim due to a non-medical necessity because the information appears to be cloned. Incorrect billing because the services documented in the EHR were not performed during the current encounter. Overbilling for a more complex case due to additional notes from the previous encounters, which leads the coder to believe that the medical condition was more complex. And costly repayment and restitution for providers who receive money from overpayments due to incorrect billing. Cautionary use of copy and paste functionality. Always remember to edit copied information from a previous note carefully to avoid the risk of inaccurate or inconsistent information. If the previous note is not accurately edited, it could cause conflicting information. Conflicting information could jeopardize the credibility of the entire note. Examples of conflicting information are history of present illness conflicting with review of systems, history of present illness conflicting with current diagnoses, or chief complaint conflicting with review of systems. Inappropriate use of copy and paste functionality. Items in the EHR that should never be copied are information from one patient chart to another, signature blocks, chief complaints, services that the provider did not provide like exams, assessments, and plans, information that has not been edited or updated within the current encounter, and information that is not pertinent to the current encounter. Do not copy elements of a previous note that contribute to billable services such as history of present illness, unless reviewed and edited. Review of systems. Note, the use of drop-down or exploding macros to check boxes of organ systems reviewed during the encounter is permitted. However, other types of copy and paste functionality may not be used for review of systems. Physical exams should not be copied, and assessment and plans should not be copied. History elements, past, family, and/or social history. This billable element may be copied but must reflect the current encounter. Please remember to review copied information. Only copy previous history or other information important to longitudinal care. Edit the information to ensure it reflects current care and medical decisions made within the same patient visit. And affirmatively state that there is no change from the previous to the current encounter to eliminate any possibility of confusion. Lab data, pathology, and radiology reports. Here are some of the do's and don'ts when using copy and paste functionality for these reports. Do: review the information without copying it verbatim. Summarize lab, pathology, and radiology reports and any other information. Show author and date of any interpretations, and document the source. Don't copy or insert macros for clinical values, for example, labs and vitals, or copy or insert a list into a progress note, examples, problems, allergies, medications, and immunizations, unless it is necessary and the information is verified. Templates and/or structured notes. These notes may be used with copy and paste functionality when these guidelines are followed. Only copy from previous notes when the information does not change, such as past medical history. And ensure accurate notes that contain information relevant to the patient's condition and services provided within the current visit. Questions to ask when using copy and paste functionality. 1. Are there more appropriate alternatives to copying and pasting information in the record to ensure safety? 2. Am I using copy and paste functionality appropriately and only as needed? 3. Have I edited information copied into the record? And 4. Am I aware of the regulatory and compliance issues associated with copy and paste functionality? Things to remember. The author is responsible for content within their documentation. The author should review the notes for accuracy, completeness, and relevance. Ensure that the documentation is in the correct patient record. Confirm that all information has been updated, and exclude unnecessary or redundant information. Information copied from a previous encounter must be edited to reflect current episode of care. Never copy information from one patient record to another, and always source the author of the information used in the current encounter so that there is no confusion as to where the information came from. Now that you have completed this course, you are able to define copy and paste functionality as it pertains to patient health information, understand and abide by Ascension's Texas policy regarding copy and paste functionality, avoid and understand the risks associated with copy and paste functionality, recognize the author's responsibility for documentation within our EHR, identify the major guidelines for copy and paste functionality in regards to appropriate and inappropriate use of this function, and identify what information can be copied and pasted and what needs to be written out with each patient visit.